Hello, good morning to one and all. Myself Dr. Atul. I am welcoming you all to my YouTube channel. So in this video, as you are seeing, we are going to discuss the anatomical class, that is a topic regarding the homologous parts of the limb. So homologous, that is the upper limb and the lower limb. So we will be discussing this point in this video. So let's start. So homologous parts of the limb, we will be discussing the upper limb versus the lower limb. So in the upper limb, first it is coming the shoulder girdle, and similarly it has been correlated in the lower limb as a hip girdle. Secondly, the joint, that is a shoulder joint. It is present in the upper limb. Similarly, in the lower limb, it has been related to the hip joint. So it is very easy to remember that you can see the shoulder girdle is been related to the hip girdle, and in the upper limb the shoulder joint is there, which has been correlated or which has been homologous to the lower limb as a hip joint. Next is the arm with the humerus. You know the humerus bone which is being present in the upper limb. So in the lower limb it is been related to thigh. Arm is there in the upper limb. It is been related to the thigh with the thigh with the femur bone. Humerus bone is related to femur bone. Thigh with femur bone. Here femur, here humerus. That is a point which is to be remembered. So in the homologous parts of the limb, we had discussed the 3 points. That is the first 3 points, that is a shoulder girdle, which is been related to the hip girdle, and shoulder joint is coming in the upper limb, which is been related to the hip joint. Thirdly, the arm with the humerus, in the upper limb, which is been related to the thigh with femur, So this is the fourth point in the upper limb is the elbow joint. To start, we have started our relation with the shoulder, that is shoulder girdle, shoulder joint, then comes the arm with the humerus, next is the elbow joint. So elbow joint will be related to the knee joint. I guess it will be related to the knee joint. Easy, if you are seeing an imaginary picture in your mind, the upper limb and the lower limb, you can relate very easily. And the fifth point it is coming is the forearm. There are 2 bones which we have discussed earlier in the videos. If anyone has missed that, please go and you can check out in the playlist, they will be there. Forearm with radius and the ulna, 2 bones of the upper. In the forearm region there are 2 bones, that is radius and the ulna. And fifth point which has been related to the lower limb as the leg, there are also 2 bones are there, that is leg with 2 bones are there, leg with tibia, that is one of the bone, and fibula, 2 bones. So forearm 2 bones are there, is radius and ulna, leg also 2 bones are there, is tibia and the fibula. And the 6th point, next is the wrist joint, which is present in the upper limb, and in the lower limb it is related to the ankle joint. Next is the last point, that is the 7th one. It is coming the hand here, and here it is been coming with a foot. So in hand there are carpus bones, there are metacarpus, and thirdly there are 5 digits. And similarly in the foot Here hand carpus, metacarpus 5 digits. Similarly in the foot region there is tarsus. In hand, in upper limb it is known as carpus, in foot, in the lower limb it is known as tarsus. Secondly, similarly metatarsus, and third one is a 5 digit, that is the 5 digit, that is same. So 7 points we have discussed here. Homologous part of the upper limb and the lower limb. Upper limb starting with the shoulder girdle, lower limb it is the hip girdle. Next is the shoulder joint, there is a and hip joint in the lower limb. Arm with humerus, there the thigh with the femur bone. Next is the elbow joint, here it is considered as a knee joint. Forearm 2 bones, here there is the radius and the ulna. Here leg with the 2 bones, that is tibia and the fibula. Wrist joint is coming in the upper limb, ankle joint in the lower limb. Hands with carpus, metacarpus and the 5 digits. Similarly lower limb is having the tarsus, metatarsus and the 5 digits. So this was some of the points which we tend to discuss in this video. Thank you for watching. Thank you.